The last presentation on the feasibility of home initiation of airway clearance device by telecare. Thank you.
So thank you for the great invitation, and I will be very short. I know that most of you have been invited to a very famous restaurant in the downtown, and I lost 50% of my time. So, So I have the great pleasure to present the main results of the Homecare Bronchiectasis trial. And I would like to thank warmly all the patients, the investigators and their team, and ERCA team for the great work, the great job they have done during the conduct of this trial. So. The goal of this trial is to evaluate the feasibility to implement a new technology for airway clearance at home, combined to telecare. And I will present the results after 3 months of Simeox therapy in a cohort of patients with non-cystic fibrosis bronchiectasis who have some difficulties to access to usual chest physiotherapy. And you know that especially during the lockdown, it was a great challenge for patients to visit their chest physiotherapist. Most of the private practice offices were closed. Hospital, there was no access to hospital, so it was a big issue for the patients. So here are my conflict of interest, not significant. So you know that in patients with chronic respiratory disease, and especially with chronic mucus hypersecretions, the overproduction of mucus and mucus stasis are a key component through a cycle vicious to lead to a decline of lung function and pulmonary exacerbation. So it's very important to provide the patient with very efficient solutions to clear mucus in their airways. So the last airways guidelines recommend regular airway clearance in patients with bronchiectasis, especially in patients hypersecretant. And in case of excessive secretions, it's recommended to clear airways every day and even several times a day. So we, in the situation of COVID pandemic, there was clearly a great limitation, and other limitations are also the availabilities of chest physiotherapy in patients' area, and also the schedule of patients and availabilities of professionals. So Simeox Technology, it's an innovative airway clearance device that generates a highly precise signal that disseminates in the lungs. And the goal of these mechanical vibrations are to act directly on the rheological properties of mucus, to liquefy secretions, and to mobilize also the secretions by a suction mechanisms from the distal airway to proximal airways to be naturally expectorated by the patients. So this device can be used with the assistance of respiratory therapists, but also in autonomy at home. So the next slide. Okay. Yeah. So the assumptions of the trial were the following. So Simeox at home can be innovative solutions for airway clearance for these patients. And combined with telecare, we will be able to train remotely these patients to the use of the device in autonomy, and also to schedule regular follow-up of Simeox therapy with motivational reinforcement for its use. So the overall purpose was to conduct a pilot clinical trial that will assess the feasibility to train remotely patients with the device, and also to collect data for designing a future well-powered RCT in this population. So here are the 3 investigating centers. So we included 22 patients with bronchiectasis and chronic mucus hypersecretion, and we first we evaluate the use of Simeox at home after 3 months of therapy, and we assess also the feasibility of telecare performed by a respiratory physiotherapist expert of the device for the training and the setting up of therapy, but also for regular follow-up every 10 days. So inclusion criteria was objective diagnosis of bronchiectasis confirmed by high-resolution CT scan with overproduction of mucus and unstable disease, and we exclude risk factor, significant risk factor for chest physiotherapy. So the primary outcome was the percentage of patients who perform at least 3 sessions of airway clearance with Simeox per week after the training period of 2 weeks. Compliance data were collected on a jury card or transferred directly on a specific server with a tablet connected to the device in Bluetooth. So we had several secondary outcomes. I will not describe everything now, but we evaluate the use of the device over time, the patient satisfaction with the use of the combined solution Simeox and telecare. We try to identify factors correlated to the adherence, and also the feasibility to perform sputum collection once a week by the patients. For clinical data, we used several questionnaires of life, quality of life questionnaires, spirometry, and of course, we collect every side effect during the study. So this is a flowchart of the study. So in ITT analysis, we analyzed 22 patients, and we have excluded 1 patient from the ITT analysis because of a differential diagnostic. After the study, patients had cystic fibrosis. So I will present the results of per protocol analysis in 21 patients. So it was mainly middle-aged women with a low BMI and with mild to moderate lung obstruction, with a severe disease, and usual comorbidities that we find in this population: asthma, COPD, and chronic sinusitis. So a patient was adherent if he used the Simeox device at least 3 times per week. And so adherence was 65% in the study when we consider the self-report compliance completed by the patient on the JIVD card. But if we add the data transfer on the web automatically, this level reach 81% of patients adherent with Simeox solution. JIVD and web data was very well correlated. Compliance for Simeox solution was very stable over the 10 weeks on follow-up, with a median range between 3 and 5 sessions per week. And we were not able to identify any factor correlated to adherence, probably because of the low sample size. We had only 4 non-adherent patients in the study. This study confirmed also in practice the feasibility for patients to collect a sputum sample every week. You can see that the medium sputum weight remained stable over time, but we had a reduction of data variability at the end of the study, showing a decrease in the EVS sputum samples. So, suggesting that patients with high volume of sputum decrease the quantity of sputum at the end of the study. We had a very high satisfaction level for the solution Simeox combined to telecare. And but it's not only because we create again social interaction between middle-aged women and very nice chest physiotherapist in video conference, but also probably because the device was comfortable and efficient for these patients. So we didn't find any change in spirometry in this population. And regarding the quality of life questionnaires, we had a significant improvement in several domains of the QL-B questionnaires, very specific to bronchiectasis patients, and especially for vitality and treatment burden score. And we had also a positive trend in health perception and social functioning that are very close to the statistical significance. Regarding the St. George respiratory questionnaires, once again, the total score improved by more than 4 units, so above the minimal clinical important difference. And each of the 3 domains, symptoms, activity limitation, and psychosocial impact, improved also above the MCID. LCQ show very similar results. The results were very close to statistical significance, but improved also above the MCID for each domain. And the CAT score that has been recently validated in patients with bronchiectasis improved significantly by more than 4 units. And so it's a significant improvement for each domains of cough expectoration especially. Regarding the safety, 4 patients were hospitalized for pulmonary exacerbation during the follow-up, but only 1 patient stopped definitively Simeox therapy at home due to exacerbation. We had very few side effects, possibly related to Simeox. No serious side effects. 3 patients had a worsening of chest pain, especially during expectoration. 4 had some worsening bleeding in sputum, and 1 had worsening GERD symptoms after 9 weeks of device therapy. But the side effects were not severe, occasional, and all of them resolved rapidly, except the patients with GERD symptoms. Despite the side effects, we have no permanent discontinuation of Simeox therapy. Only 1 patient stopped temporarily during 48 hours. So in conclusion, patients with non-cystic fibrosis, bronchiectasis, with chronic mucus hypersecretion have a high level of midterm compliance with the combined solution Simeox and telecare, and a very high satisfaction for its use. Both remote training in Simeox use and therapeutic follow-up by telecare are therefore feasible. That's the conclusion of the feasibility study. And the results suggest also that Simeox therapy is safe and efficient to improve airway clearance and, as a result, symptoms and quality of life. Of course, the clinical effectiveness of this procedure must be evaluated in a well-powered randomized controlled trial in this population. Thank you very much for your attention.
Thank you very much, Laurent. Do we have questions in the room? So what are the next steps after these fascinating results?
We have amazing data, especially on quality of life. And the next step is to design now a very well-powered RCT in this population, where clearly the target population for this technology, patients with bronchiectasis and mucus and chronic mucus hypersecretions. And there is also high expectations from this population to get very efficient airway clearance therapy. So that's the next step to design this multi-center trial.
Discussing with Jean-Christian, I think the very original topic is this patient without any access to care with good physiotherapists. It's one point. And the second question, what is the total population of this patient with non-cystic fibrosis bronchiectasis? I am unclear with the size of the population.
You are talking about the prevalence?
Yeah.
Yeah, effectively, it's quite difficult because these patients have a lot of respiratory comorbidities, asthma, and COPD. But we estimate in France probably roughly 40,000 patients with bronchiectasis in France. Yeah.
So it's a significant and huge population. Okay, if we have no additional... you have a question, John? Sorry.
Thank you for showing the data. I just was going to ask you what you think is the right control therapy for these kind of trials. That's tricky, I think.
It's a great question. Effectively, because it depends of the practice, the routine practice in countries, and there are some significant differences. But probably the gold standard in these patients is mucolytics, surely. And for airway clearance, conventional chest physiotherapy, at least. Perhaps it depends of countries, but some countries use, for example, PEP device. That can be also something to be considered for the group control group. Yeah.
Is it feasible to have a sham device, or do you think it's ethical and feasible to have a sham device?
No, it's also a good question. The problem is to replicate a sham signal in this device, and probably it will be very complicated to convince the patients to use the device who have the same problems with CPAP or NIV. Yeah.
Yeah, so thank you very much. I think we have very insightful talks during this session, and I would like to thank Agiradom, Homecare provider, with a large audience in different regions in France. So thank you very much to the organizer and for staying here until 7 p.m. And now, as you said, it's time to go to the restaurant.
and thank you to the orators.